So what was the logic of the nationwide lockdown that we've seen? Well, among other things, one of the major reasons was to give the country time to prepare medical infrastructure, to build up the medical infrastructure so that when cases start to mount, as perhaps inevitably they will, we are prepared for that. And that's happened in some areas, such as PPEs and even the building up of basic testing capabilities. However, in some of the places which are seeing the largest number of coronavirus cases now, some strain is starting to show, and especially when it comes to hospitals, to hospital beds, to coordination. We're hearing too many anecdotal stories coming out of patients having to go to one hospital and not being able to get admission, then having to go to a second hospital and then being told you need to get coronavirus testing and not knowing where that testing is going to happen. It's becoming a bit of a mess, and it's becoming very confusing for many patients. And this is especially, as I said, in the worst affected areas such as Mumbai and Delhi. But today you had the Delhi Chief Minister, Arvind Kejriwal, coming out and saying that any private hospital who is turning away patients who are requiring coronavirus care, action will be taken against them. He almost accused hospitals of engaging in black marketing. And look, there are solutions that are being worked on. We do have this nifty little app which is supposed to tell you exactly where beds are available and which hospital you can go to, and not only beds, but also where ICU beds will be available or ventilators. And that's a great idea, but it has to be implemented on the ground. There is no reason why patients or the families of people who are in distress are having to go driving around from one hospital to a second hospital, trying to figure out testing, trying to figure out where admission can happen. This is a solvable problem. Now again, various state governments, and especially in Mumbai and Delhi, which are the worst affected, have said they're going to try and fix this. They're going to try and have a more simplified manner in which this can be reflected. The Delhi government is, for example, saying the coronavirus app, the bed or the hospital-related coronavirus app is going to have real-time information. Needs to be done, and it needs to be done fast, because as we've been telling you all along, and we're going to go on telling you, cases are rising. Cases are continuing to grow at 4-5% a day, which means whatever the numbers are right now, it'll be double that number in 15 to 16 days if the cases don't slow down. So we need to sort out this entire confusion around testing in hospitals, and we need to do it now. There are the big stories.
The number of coronavirus cases in India rose past 2.36 lakh, taking the country to the 6th spot worldwide above Italy. According to the Health Ministry data released on Saturday morning, India recorded 9,887 new virus cases and 294 deaths in the last 24 hours. This is the biggest single-day jump in cases and fatalities till now. The total number of cases now stands at over 2,36,000. The number of deaths due to the contagion has gone up to 6,642. More than 1,14,000 people have recovered from the infection so far. Amid reports of hospitals turning away COVID patients in the capital, Delhi Chief Minister Arvind Kejriwal on Saturday issued a stern warning to such hospitals. Kejriwal said that while most hospitals are playing a positive role during the pandemic, there are a few that are indulging in black marketing of beds. The Chief Minister warned that such hospitals will not be spared.
ऐसी महामारी के दौर में मोस्टली अस्पताल सेवा कर रहे हैं, मोस्टली अस्पतालों का पॉजिटिव एटीट्यूड है, लेकिन जो 2-4 अस्पताल इस गुमान में हैं कि वो अपनी दूसरी पार्टी के अकाउंट जो बैठे हैं उनके जरिए वो अगर कुछ करवा लेंगे, वो अपनी ब्लैक मार्केटिंग करेंगे, तो उनको मैं आज चेतावनी देना चाहता हूं कि बख्शा नहीं जाएगा.
The Delhi government has dismissed media reports on shortage of hospital beds in the capital, claiming that close to 5,000 beds are laying vacant. Health Minister Satyendra Jain has said that in the last 3 days, more than 1,000 patients have been admitted to various hospitals in Delhi. If beds were not available, this would not have been possible. Even now, we have close to 5,000 vacant beds. He added that the issue was that some hospitals are not updating the data on the app that tracks hospital beds.
The Tamil Nadu government on Saturday capped the charges for COVID-19 treatment in private hospitals across the state. The per-day charges for treatment in ICUs has been capped at 15,000 rupees and in general wards for asymptomatic people. And those with mild symptoms, the maximum charge is 7,500 rupees, the government release stated. No fee over and above the fixed slab can be claimed from the patients.
6 officials of the Enforcement Directorate have tested positive for coronavirus, and the headquarters of the probe agency have been sealed for 2 days, reports said. Over 10 officers who came into contact with the infected officials have been quarantined. Recently, a junior rank officer at the headquarters had tested positive for the virus. He was on deputation to the investigative agency from a central paramilitary force, news agency PTI reported, quoting officials. Odisha on Saturday reported its highest single-day spike in COVID-19 cases after 173 more people tested positive for the disease. The total COVID tally in the state has gone up to 2,781, a health department official said. Of these 173 cases, 150 were in quarantine centers where people returning from different states are staying. 23 others were detected with the infection during contact tracing exercises. The COVID-19 transmission rate, or the number of people getting infected by an already infected person, has been going down steadily in India. The Indian Express has reported that it is now the lowest since it began to be calculated early in the outbreak. India's transmission rate stood at 1.83 at the beginning of the lockdown in March, which means that every 100 infected people were transmitting the disease to another 183 individuals. Due to the lockdown, this number declined to 1.49 and has now further declined to 1.22, the report said.